All right, so this was the diagram of the tooth that was in your fill in the blank notes that wanted to make sure that we covered. So 3 basic areas of the tooth, got the crown, the neck, and the root. Okay, so the crown's what you usually see. The neck is kind of what's embedded in the gums, and the root's embedded in the bone below in your jaw. Okay, and the maxilla of the mandible. In the crown, structures you need to know are the enamel. That's kind of what you see the outer surface of your tooth. You have material called dentin underneath. All right. You don't necessarily need to know the tubules. Okay, that's not one of the ones that you'll have to know. You do need to know this is called a pulp cavity. Okay, you've got blood vessels and nerves in here, so that's why you can feel it. Okay, you have pain in your teeth because you've got nerves there. Yeah, so the middle. So the blue is the red and the blue are arteries and veins, or arterioles and venules, and then the yellow is the nerves. It's kind of hard to see, but there's yellow there. All right. So your gums, technically, we call that gingiva. So when they say, this mouthwash helps you with gingivitis, or these toothpaste helps you with gingivitis, they're talking about inflammation of your gums, okay, or the gingiva.
Weird question.
Sure.
My brother-in-law has periodontal disease.
Okay.
So would the gingivitis go, like, somehow make, since if you have gingivitis, that your gums also start pulling away from the teeth, so would that go with periodontal?
It can. Yeah, it definitely can. All right, so holding the tooth in place, this thin layer of what we call cementum, okay? Now, that cementum is sort of held to the bone by what we call a periodontal ligament, okay? And then basically extending out from the pulp cavity into the base of the bone is your root canal. Okay, you tend to think of a root canal as a procedure, but it actually is a part of your tooth structure. Okay, so those are the main structures in the tooth that you need to know. Okay, were there any other blanks on there? I don't think so. I think that's all of them. So, alrighty. So what we're gonna do now is we're actually going to transition to the into the lab, into the prep room, and look at the Syndaver. Okay, I'm going to try to bring this up on my phone so those that are watching can see that. All right, so we're going to go ahead and do that. Just a moment. All right, so let's see about just pause. Yeah, that's how we'll do it. All right. So I'm actually going to put this down for a second.
You want me to hold it for you?
I'll hold it, but we'll get started. So we'll cover respiratory and digestive systems. Again, we've got oral cavity, right? And our teeth, got our incisors, right? Got our cuspids, bicuspids, and our molars, right? So kind of difficult to see in here, but let's see if we can get to trachea. I guess this is actually part of the trachea. Yeah. All right. So here you got your lungs. I don't know if you can see that, but here's the right lung. It's got 3 lobes. If you're able to hear, left lung has 2 lobes. Okay. So we don't have this disconnected, so you really can't see the trachea and the primary bronchi. All right. But we can look a little bit at the digestive system. Okay. So we don't have a great view of the esophagus, but what we do have a good view of, what organ is this? You want to remember? The liver. What about this one? Gallbladder. What's all this? Small intestine, which would then make this the large intestine. Okay. Reach down in here. That's actually a kidney, so that's not. We're not looking at urinary till next week. All right. So I know you're like, he's just digging around in there, but you know. All right. All right. How about that? Well, close. Pancreas. Okay. So this is more of the stomach. Okay. That would be empty, obviously, right? So, but yes, this is our pancreas. All right. So we got descending colon going down to the rectum and anus. Okay, so that is most of what we've got here in the digestive system. So, anybody want to get gloves on?
I do. Please.
All right. All right. So I'm going to turn off the video. We'll come back and